Assalamualaikum and hi to our dearest viewers. Today, my groupmates and I, the pharmacy students from UiTM Cawangan Pulau Pinang Campus Bertam, are going to provide some educational information on some of the common skin disorders and their treatments. First of all, introducing the group members for today's video. So, let's get started with our first presenter. I'm Nur Amanini is going to explain some information regarding this granule ointment that is used to treat psoriasis. What is psoriasis? According to MIMS Malaysia, psoriasis is a systemic chronic skin illness characterized by increased keratinocyte growth in the epidermis and dermis. Or basically, the skin cells undergo multiple mitosis process which causes the build-up on the skin. Facts about psoriasis. Psoriasis can be found in around 2 to 3% of the population worldwide. Psoriasis is not contagious, so you don't have to be worried if you touch someone with psoriasis. Psoriasis mostly affects the skin and joints, especially scalp and nails. Psoriasis is associated with other inflammatory disorders and autoimmune diseases such as psoriatic arthritis, inflammatory bowel disease, and coronary artery disease. Trauma such as injuries, infections such as HIV, medicines such as ACE inhibitors and beta blockers, smoking, alcohol, and stress are all the factors that worsen psoriasis. Next, we are going to compare and contrast between this granule ointment and calcipotriol ointment. The similarities between these two ointments are both ointments used to treat plaque psoriasis. Apart from that, both ointments help in slowing down the growth of skin cells. And lastly, both ointments are for topical use. This granule ointment is an over-the-counter medicine and also available on prescription. However, calcipotriol ointment is not an over-the-counter medicine and should be prescribed by a doctor or pharmacist. This granule ointment stain the skin, hair, clothing, and hands should be washed immediately after applied on skin. But calcipotriol ointment does not stain the skin, hair, and clothing. This granule ointment is considered as short-term treatment in psoriasis, while calcipotriol ointment are considered as first-line treatment in psoriasis. This granule ointment is used to treat psoriasis alone or in combination with other medications. It is also available as cream and paste. This granule only applied on psoriasis skin and not on healthy skin. It is absorbed into the skin cells and slow down the cell division to stop the cells from multiplying excessively. Your doctor may prescribe this medication to address different ailments. So how to use this granule ointment on scalp? First, you need to comb your hair to remove any scales. Second, part your hair as necessary and rub the ointment into the affected areas carefully with clean hands. Lastly, wash your hands immediately after applying to avoid staining other things. Next, how to use this granule ointment on the skin. First, wash your hands or you can use gloves to protect your hands. Second, clean and dry the affected area. Third, rub a thin layer on the affected skin only. And lastly, wash your hands immediately after applying to avoid staining other things.
Now, we will continue with the next product, which is sodium ointment. There are several uses of sodium ointment. It helps in treating ringworm, acne, rashes, and also blackheads. For your information, ringworm is a skin infection that is caused by the fungus. Next, acne is a skin condition that occurs when hair follicles become plugged with oil and dead skin cells. Besides that, rashes is an area or irritated of swollen skin, and the last one is blackheads. Blackheads is a small bumps on skin that result from clogged hair follicles. Nizodom ointment consists of 6% of benzoic acids, 2.5% of salicylic acids, and 4.6% of precipitate sulfur. So, how these ingredients helps you in treating your skin disease? The first ingredient, which is benzoic acid, acts as a preservative and it has antifungal properties. So, it helps in treating fungal infection on human skins. The second ingredient, salicylic acid, helps in soothing, exfoliant, and it is also an anti-acne ointment. It is a keratogenic agent that can treat and prevent acne. The last one is precipitated sulfur, acts as an antibacterial and antiseptic properties. These ingredients helps in targeting for fungal infection and killing parasites. As Nizodom ointment consists of salicylic acid, here is the compare and contrast between ointment that contains salicylic acid and ointment contained with benzoyl peroxide. Salicylic acid ointment is more effective in treating hormonal acne compared to benzoyl peroxide ointment that's less effective for hormonal acne. Next, salicylic acid ointment may be safe for sensitive skin than benzoyl peroxide ointment. The last one is ointment with salicylic acid is less irritating and drying if we compare with benzoyl peroxide ointment that's more irritating and drying if we apply to the skin. Did you know how to use Nizodom ointment? So, let me share with you some steps on using these products. First, apply a generous amount of Nizodom ointment on your affected skin to ensure entire surface is covered. Then, let it dry. This ointment can be used twice daily, which is in the morning and also in the evening. Then, you need to continue this cycle for 7 days and discontinue for 3 days. The treatment is continued until the affected area of your skin are recovered. In this ointment, there are some precautions that you must to follow. First, you need to discontinue and consult a doctor if excessive burning, stinging, and peeling occurs. Next, you need to bear in mind that this is for external use only. It is unnecessary to wash your hand before and after applying Nizodom ointment onto your skin. Immediate stop using the product is having allergic reactions, and the last one is keep out of reach of children.
CeraVe Eczema Creamy Oil. CeraVe Eczema Creamy Oil, ideal for eczema-prone skin. This product effectively moisturizes and helping the skin maintain its natural protective barrier. For additional information, what is eczema? Eczema is a skin condition that causes dry, itchy skin, which can result in flaky skin, bumpy skin, inflamed skin, and irritated skin. Eczema is also known as atopic dermatitis. There are some examples for eczema. So, here we can see that eczema will appear on the body and face. Next, let me tell you what is inside this cream. So, for the first one is 1% collodial oatmeal for protect and help relieve minor skin irritation and itchy due to eczema. The second ingredient in this cream is ceramide. Ceramide can help restore and maintain the skin natural barrier. Next, hyaluronic acid. Hyaluronic acid can help to retain moisture for our skin. And the last one is niacinamide. Niacinamide can help to calm the skin. This product is suitable for skin because non-comedogenic, fragrance-free, paraben-free, and dye-free. So, it is very suitable for skin, especially for eczema and sensitive skin. So, let me teach you how to apply this cream. Okay, firstly, you need to wash your hand to prevent infection. Next, clean and dry the affected area before application. Rub the cream gently on the affected area. The last one is wash your hand after using this product to maintain your hygiene. For compare and contrast, I compared Eucerin Eczema Relief Body Cream with CeraVe Eczema Creamy Oil. This product has some similarities such as fast absorbing into the affected area and gentle enough for everyday use. However, this product also have differences. For example, Eucerin Eczema Relief Body Cream is an old brand, while CeraVe Eczema Creamy Oil is a new brand. Active ingredients in Eucerin Eczema Relief Body Cream are ceramide 3, NMFX, and shea butter, while CeraVe Eczema Creamy Oil use hyaluronic acid and ceramide as their active ingredient. There are some precautions for this product. First, protect from light and moisture. Second, keep out of reach of children. And last one is, if you have any health problems, consult your doctor or pharmacist before using this cream.
Protropic tacrolimus ointment. Use of protropic tacrolimus ointment. Tacrolimus ointment used to treat the symptoms of atopic dermatitis, a skin illness that causes dry, itchy skin and occasionally develop red, scaly rashes to the patients. Symptoms of atopic dermatitis: first, oozing; second, scaling; third, open sores; fourth, crusting; and fifth, blisters. Compare and contrast between tacrolimus ointment and pimecrolimus cream in treatment of atopic dermatitis. In terms of safety and efficacy, 0.1% tacrolimus ointment produces more adverse events than 1% pimecrolimus cream in adult patients. But tacrolimus has higher tolerance than pimecrolimus. It has faster onset of actions in adults and children with atopic dermatitis. Thus, 0.1% tacrolimus ointment is more effective than 1% pimecrolimus cream. Next, dosage and indications. Protropic 0.03% ointment is for the children aged 2 to 15 years, while protropic 0.1% ointment is for the patient aged 16 years and above. Ointment should be applied thinly to the affected area twice daily until lesion clearance. Protropic tacrolimus ointment is the second-line therapy for treatment of moderate to severe atopic dermatitis for adults and children. How to apply tacrolimus ointment? First, apply a thin layer of tacrolimus ointment to all affected areas. Second, rub the ointment into your skin gently and completely. Next, cover the treated areas with normal clothing. Do not use bandage or wraps. And lastly, do not swim, shower or bath immediately after applying tacrolimus ointment. Special precaution. If you have symptoms of chickenpox while using tacrolimus ointment, immediately call your doctor. Pregnant women are not recommended using tacrolimus ointment. This ointment cannot be applied under occlusive dressing and cannot be used to children under 2 years. Please tell your doctor if you are allergic to tacrolimus ointment, and please tell your doctor if you are taking other supplements or medication to check the dose given are correct and carefully monitor your conditions. Side effect of the ointment: itching, skin burning, redness, rash, and cold sores. Storage. Protopic tacrolimus ointment should be stored at room temperature and away from heat and moisture, and it can be kept for 30 months. Remember to keep out of reach of children and keep the ointment in tightly closed tube container.
Next, I will proceed with Himalaya cream for acne. What is acne? Acne is a skin condition that occurs when hair follicles become plugged with oil and dead skin cells. In this slide, you can see that there's many places that acne can be found on our face, which are forehead and nose, hairline, eyebrow areas, ears, jawline and chins, and the last one is cheeks. Next, I will proceed with compare and contrast the product. Both Himalaya Cream Acne and Papulex Oil Free Cream acts to prevent acne. Himalayan Cream Acne has lentils, which is lens culinaris, act as microbial or antibacterial. While Papulex Oil Free Cream Acne has antibacterial adhesive, which is ABA, substance help block acne bacteria to lower the chance of infection. Himalaya Cream Acne has Indian aloe, which is Aloe barbadensis, acts as moisturizing, emollient and anti-inflammatory, while Papulex Oil Free Cream Acne has nicotinamide, which is niacinamide, lessens scarring by controlling inflammation and pigmentation. Next, functions of Himalayan cream. Himalayan cream can control acne and pimple, keeps skin soft, prevents future breakout, reduces inflammation and heals and softens the skin. Okay, next, patient information. For the frequency, Himalayan cream need to be used twice daily. Single maximum dose. Take medicine on finger in insufficient amount and apply gently on the affected area. For the general precaution, rinse the affected area with normal or lukewarm water. Next, I will proceed with ingredients that can be found in Himalaya cream. The first one is processed alum that we can call Saurastri pasma. The next one is lentils that we can call, other than lentils, we can call lens culinaris. Then Indian aloe, which is Aloe barbadensis. Next, shalmali, we can call Salmalia malaberica. Next, 5-leaf chestnut tress, which is Vitex negundo. And the last one, water or aqua. Next, functions of ingredients. For water and aqua, it acts as solvent for ingredients. For Indian aloe, which is Aloe barbadensis, acts as moisturizing, emollient and anti-inflammatory. And the last one for lentils, which is Lens culinaris, acts as antimicrobial or antibacterial. Next, how to use Himalayan cream. Firstly, we need to wash or rinse face properly. And next, we need to apply a small quantity of pimple clear cream over the affected areas twice a day. Last but not least, here we can see how Himalayan cream acts to treat acne, how it effective to treat acne, before and after picture. Lastly, how to store Himalaya cream. We need to store in a cool and dry place. We also need to keep out of reach of children.
Elomet ointment 0.1% for eczema. What is eczema? Eczema is the name for a group of conditions that cause the skin to become itchy, inflamed, or have a rash-like appearance. Common eczema triggers include irritants, for example soaps, detergents, and chemicals, allergens such as dust mites, pests and pollens, microbes such as Staphylococcus aureus, or temperature, foods, and hormones. About Elomet ointment 0.1%. Each gram of Elomet ointment 0.1% contains 1 mg mometasone furoate, hexidine glycol, white wax, propylene glycol stearate, white petrolatum, purified water, and phosphoric acid to adjust the pH. Elomet ointment 0.1% is indicated for the relief of the inflammatory and pruritic manifestations of corticosteroid responsive dermatosis. The active ingredient, which is mometasone furoate, belongs to the class of moderate potency, group 3 corticosteroids. Elomet ointment 0.1% versus H-cord ointment. Both ointments are not to be applied near the eye area. Both ointments also are not for prolonged use. Elomet ointment 0.1% contains mometasone furoate, which is a moderate potency steroid, while H-cord ointment contains hydrocortisone, which is low potency steroid. Elomet ointment 0.1% produce significantly better improvement despite once daily application, while H-cord ointment produce slower improvement despite twice daily application. How to use Elomet ointment 0.1%? Always use Elomet ointment 0.1% exactly as your doctor has told you. Check with your doctor or pharmacist if you are not so sure. A thin layer of Elomet ointment 0.1% should be applied to the affected skin areas once daily. Do not use for more than 3 weeks. Check with your doctor before covering the treated areas with a bandage or plaster. Treated areas on the face or in children should not be covered with a bandage or plaster. If you forget to use your ointment at the right time, use it as soon as you remember, then carry on as before. Remember to measure the amount to be applied using fingertip unit or FTU. Special precautions. If your skin becomes irritated or sensitive after using this ointment, you should stop using it and tell your doctor. Contact your doctor immediately if you experience blurred vision or other visual disturbances. This ointment may be used by pregnant women or nursing mothers only if the potential benefit justifies potential risk to the mother, fetus, or infant. This ointment may cause side effects. These include burning, pruritus, stinging, and signs of skin atrophy. Storage. The ointment should be stored below 30 degrees Celsius. The ointment should be kept out of the sight and reach of children. Do not use the ointment after its expiry date, which is stated on the carton. Lastly, do not throw away any medicines via wastewater or household waste. This will help protect the environment.
Next, I will continue with a gel-type medication which is gel for acne, named T3 adapalene. Introduction for this product. T3 adapalene used for treat acne vulgaris, which is a common chronic skin disease involving blockage and or inflammation of pilosebaceous unit. Factors that cause acne. First, follicular epidermal hyperproliferation with subsequent plugging of the follicle. Second, excess sebum production. Third, the presence and activity of the commensal bacteria named Cutibacterium acnes. Fourth, inflammation. And fifth, genetics. Compare and contrast of the product. Adapalene gel was compared with benzoyl peroxide gel. Both gel is used to treat acne vulgaris and have the same side effects. Example brand for adapalene is Adapalene, and example brand for benzoyl peroxide is Benzac AC. For the use of this gel, adapalene is applied once daily at bedtime, and benzoyl peroxide is 3 times daily. Adapalene works by encouraging the growth of skin cells, thus it can decrease acne growth, while benzoyl peroxide works by killing the bacteria that cause acne and improve growth of new skin cells. Next, for use of product and patient information. This tea tree adapalene gel contains adapalene as its active ingredient. Description for this product: it is an off-white opaque viscous gel that contains 0.1% weight overweight adapalene, and it works as anti-acne. And it also contains 0.2% weight overweight methylparaben and 0.5% weight overweight phenolcyethanol that works as preservative. For indication or use of this product is only used for acne vulgaris where comedons and pustules predominate. For dosage or direction for use, this gel is applied only once daily to affected areas after washing at bedtime. Next, special precautions for this product. First, discontinue this gel if chemical sensitivity or irritation occurs. Next, not to be applied to skin abrasions, eczematous, and sunburned skin. Third, minimize exposure to sunlight or sun lamps. Fourth, avoid contact with eyes, lips, and mucous membranes. And fifth, not to be used in women of childbearing potential and during pregnancy. Storage for this adapalene gel. First, keep container well closed. Second, this gel must be stored below 30 degrees Celsius. Third, this gel is only for external use only, and recommended shelf life for this gel is 3 years. And last but not least, adverse reactions for this tea tree adapalene gel. First, sunburn. Second, acne flares. Third, dryness. And fourth, skin irritation.